our guest this morning is Mrs. Jumai Rosamond Marioghae, and you're welcome to Close Flow.
Thank you very much.
Now, I didn't want to say too much about you before some people will say, oh, she has made all the money before she started doing education. So let's first keep our tracks on what we want to do. Now, when you say autism, I'm sure I am as confused as some of our viewers. You have autism, you have dyslexia, you have Down syndrome, you have... So what exactly, what is it? What is autism? How do you differentiate this from the other challenges that children may have?
Okay, autism is very simple. It's a neurological disorder. It's genetic. Something in the environment triggers it off. Up till date, we do not know what. What the classic signs of autism are: lack of language, communication, that is, so to speak, behavior, inappropriate behavior, and social interaction, inability to play with it. For example, a typical child will, at 2 years old, is running around and playing with her peers. An autistic child will not do that. An autistic child...
Would rather be alone?
Yes. They're sitting aloof, so to speak, and doing their thing.
So now, but there is a word that you use that I'm a little bit, worried about.
Okay, aloof is...
No. Inappropriate social behavior. How inappropriate would that be?
Inappropriate behavior.
Yes.
I'll give a very simple example. For example, you buy a child turns 1.
Okay.
Typically, most parents buy a bicycle, a tricycle. An autistic child will not sit on that bike and try to ride it or pedal it. What an autistic child will do is flip it upside down and spin the wheels. So that is inappropriate. So they don't know what to do. We need to teach them. Yeah. What we do is teach them to ride.
Now, the environment that you learned how to do this, I mean, going back to UK to go and take a degree in special education, will have exposed you to a different environment in dealing with this. So do we have that kind of environment here?
Yes, I will say so. There are quite a few people who are trained and have the instruments or
the skills, the tools,
the assessment tools to make a diagnosis and say, tell you your child has autism. And from there, you go on to intervention, what we call remediation. If a child can't speak, for example, the classic intervention we use is what we call Picture Exchange Program, PECS. So what we do is put a picture of, let me use something simple, maybe a drink, water,
okay. Yeah.
Water, for example. So we put water and we put water underneath
for the child
in letters. So the child sees the water and say, I want water. But I mean, they're not speaking to you. They'll probably hold your hand and
to go and take the water.
Yes, that's the means of communication.
Okay, but let me just jump into your brain. But this picture exchange that you're talking about, that is almost like a classical thing that everybody you learn by rote as you're growing up. So what is so different from that? I mean, you have A for apple, B for ball, this for...
Well, picture exchange also teaches them language, which they don't have. A typical child grows up just knowing these things, knowing everything. An autistic child
as a matter of course
is clueless.
Now, let's begin to maybe for some parents who are watching. So how do we begin? What are the symptoms? What are the indicators? What are the things that the child will exhibit that will begin to give you an inkling that this child will be autistic before you now say, okay, let's go and diagnose or let's go and do this?
The first thing is lack of communication. They do not talk. They won't speak. So that should raise a red flag.
From what age to what age would that be?
Okay, let's go back. Let's backtrack a little bit. Some children do
Have
from 18 months babble,
Okay.
you know,
Yes.
the way an
Yes.
18-year will or say dada. But somewhere along the line from the age of 2 to 3, they lose the language. That's some. Some never talk at all. From age 18 months, no babble, no
nothing.
language, nothing. Zilch. So it's language. That's the first sign. And then, of course, the behavior. Because they're some of them are aggressive. They would pick up this, for example, and
fling it and smash it.
throw it, bang the table, yeah, come sort of touch you, you know, sort of push you, all sorts of things that are inappropriate.
Great.
A
For that-
normal
for it,
child
yes,
will not do it.
that.